Tuberculosis, a disease often relegated to history books, has re-emerged as a pressing public health concern in the United States. The nation is grappling with its largest outbreak in decades, centered in Kansas. This outbreak serves as a stark reminder that infectious diseases, even those thought to be under control, can quickly resurface. Understanding the scale of this outbreak, the nature of tuberculosis, and the steps being taken to address it is crucial for everyone. This outbreak is a wake-up call. It underscores the importance of public health infrastructure and the need for continued vigilance in preventing the spread of infectious diseases. While the situation in Kansas demands immediate attention, it also presents an opportunity to learn, adapt, and strengthen our defenses against this ancient foe. The epicenter of this alarming tuberculosis outbreak is Kansas, specifically Wyandotte County. As of January 24, 2025, the numbers paint a concerning picture. 67 individuals are battling active tuberculosis, with a further 79 harboring latent infections. These figures represent the largest surge in cases since the Centers for Disease Control and Prevention began meticulously tracking the disease in the 1950s. The outbreak's tentacles, while primarily gripping Wyandotte County, have also reached neighboring Johnson County. The first cases emerged in January 2024, and tragically, 2 lives were lost to the disease last year. The outbreak remains active and health officials are bracing for the possibility of further infections. Tuberculosis, often referred to as TB, is triggered by a bacterium known as Mycobacterium tuberculosis. This bacterium primarily targets the lungs but can also wreak havoc on other organs. Transmission occurs through the air, with infected individuals expelling microscopic droplets containing the bacteria when they cough, speak, or even sing. Symptoms manifest differently depending on whether an individual has active or latent TB. Active TB is characterized by a persistent cough lasting more than 3 weeks, often accompanied by blood or phlegm. Chest pain, weakness, fatigue, unexplained weight loss, loss of appetite, fever, chills, and night sweats are also telltale signs. Latent TB, on the other hand, is a silent threat. Individuals with latent TB carry the bacteria but do not experience symptoms and cannot transmit the disease. However, latent TB can transition into active TB, particularly if the immune system is compromised. Thankfully, tuberculosis is treatable. The standard regimen involves a cocktail of antibiotics taken diligently for a period of 4 to 9 months. The duration of treatment varies depending on individual patient needs and the presence of coexisting conditions such as diabetes or HIV, which can complicate matters. While a vaccine known as BCG exists, it is not routinely administered in the United States. The BCG vaccine is more prevalent in countries grappling with high TB rates. In the U.S., the low incidence of TB, coupled with the vaccine's variable effectiveness in adults and potential interference with TB tests, has limited its use. Health officials are actively monitoring the situation in Kansas, working tirelessly to identify and treat infected individuals and trace their contacts to curb further spread. The risk to the general population outside the affected Kansas counties remains low. However, it's crucial for everyone to be aware of the symptoms of TB and seek medical attention if they experience any. Early detection and treatment are paramount in containing the spread of this resurgent disease.